talking with Cherise Scott, Director of Pediatrics for TB Alliance. Please tell us about the new pediatric drug for TB.
Yeah, this is an amazing achievement, I think, for the field of TB. We're talking about simplified treatment, affordable treatment, treatment that's easy to take by those treating children that are affected by tuberculosis. These are fixed dose combinations, so it doesn't require a huge amount of pills. We're combining the drugs into nice pills that can be dropped into a small amount of water and dispersed into solution. So it gives a lot of options for caregivers, for health providers in the field.
Mm-hmm. And they're flavored, correct?
And they're flavored, so that's a big deal because a lot of times it's already difficult to give a child medicine, and for it to taste bitter, it causes them to spit up, to vomit, to refuse, and then they don't get treated and they don't get cured. Mm-hmm. So this allows for children to get cured, and it helps child survive.
Mm-hmm. And what is the name of the drug, and how will it be disseminated?
So the drugs are in just improved formulations of existing drugs used to treat tuberculosis. So those drugs are isoniazid, pyrazinamide, and rifampicin. So we have a 3 drug, which is used for the first 2 months of treatment. So that's isoniazid, rifampicin, and pyrazinamide. And then we have a 2 drug, which is isoniazid and rifampicin, which is used for the remaining 4 months of treatment. Mm-hmm. So this is really good and wonderful in the sense of, like I said, it really helps children take this treatment, which can be 6 months is a long period of time. So as easy, as simple as you can make that, the better it is. And they're in the correct dosages for children, which means that they're much more effective and provides the ability for children to take them.
Mm-hmm. And how many children get tuberculosis, and how are they affected when their parents get TB?
The new estimates out of the World Health Organization now says that over 1 million children get tuberculosis a year. And then out of those, we have 140,000 deaths. So they die of TB if they aren't treated, and they're not identified as well. And out of that 140,000, that does include HIV-positive children. Mm-hmm. Or children with HIV.
And what's in the pipeline for pediatric TB? What's down the road?
So we're looking forward. There's a few additional formulations that we hope to come to market in the next year or a year and a half, and that's single drugs that are needed as well. So ethambutol is often used to treat children with TB. And we're trying to make that into dispersible in a flavor form, so that should be available next year. And as well as INH, or isoniazid, which is used for preventative treatment. So there's a huge population of children that we have latent infection. And so we want to prevent them from getting active disease. So a good way to do that is to give therapy with isoniazid.
And what's the prospect for a vaccine?
Vaccines are a little longer off. There's still hope for that, and it's something that could very much impact the epidemic. And it looks to be about 10 to 20 years off.
Great. Thank you so much.
Okay, thank you.